A Gynecologist Guide to Bladder Control, the Power of Kegels and Yoga for Women After 50. Have you ever shared a hearty laugh with a dear friend, been caught off guard by a sudden sneeze, or found yourself rushing to the bathroom only to experience that little, unexpected leak? If this sounds familiar, please know that you are in vast and good company. Millions of women, particularly after reaching the age of 50, experience the challenges of urinary incontinence. It can feel embarrassing, profoundly frustrating, and at times, even isolating. But here is the wonderful news. Your body possesses powerful, innate ways to protect itself. And two of the most effective and accessible tools are already well within your reach: Kegel exercises and the practice of yoga. Today, my goal is to show you precisely how they work, to explain why they matter so deeply, and to guide you on how you can begin to feel stronger, more confident, and more fully in control of your body. I am Dr. Lily Stones, and I have dedicated over 30 years of my medical career to helping women just like you navigate the complex physical changes that come with age, menopause, and life itself. Here on our channel, Elder Care Wellness, we are committed to bringing you evidence-based practical advice to help you stay active, healthy, and genuinely empowered. If you find this topic to be helpful, I warmly invite you to subscribe and to share your thoughts in the comments section below. I would be honored to hear about your personal experiences. Let's begin with the first essential concept: the vital role of your pelvic floor. I want you to imagine a supportive sling of muscles and connective tissue stretched across the base of your pelvis. This intricate muscular sling is responsible for supporting your bladder, your uterus, and your bowel. When these crucial muscles begin to weaken, a process often influenced by childbirth, the natural course of aging, or significant hormonal changes, you may start to notice small leaks of urine when you cough, sneeze, or engage in physical exercise. This is what medical professionals refer to as stress incontinence. The stronger and more responsive your pelvic core is, the more effectively it can hold up these organs and keep you comfortably dry. Kegel exercises, named in honor of Dr. Arnold Kegel, who first introduced them in the 1940s, are essentially a form of strength training for this internal support system. Just as lifting weights can build the strength in your biceps, the act of contracting and releasing these hidden muscles systematically builds their resilience and your control. Extensive studies published by the National Institutes of Health have demonstrated that women who practice Kegel exercises on a regular basis can reduce leakage incidence by as much as 70%. That is a powerful and life-changing return for just a few minutes of dedicated daily practice. One of my patients, Maria, a vibrant 62-year-old grandmother, once confided in me that she had begun to avoid long car rides with her family because she was constantly worried that she would not be able to make it to a restroom in time. After just 3 months of consistent Kegel practice, she proudly shared with me that she had taken her grandchildren on a day trip to the zoo without a single accident. That renewed sense of confidence and freedom is exactly what I want for you. But here is the common challenge. Many women believe they are performing Kegels correctly when, in fact, they are not. The key is learning how to accurately identify and isolate those specific muscles. Try this simple exercise the next time you are urinating. Attempt to pause the flow of urine midstream. The very muscles you engage to stop that flow, that is your pelvic floor. Now, it is important not to make a regular habit of practicing during urination, but once you have identified that unique sensation, you can contract and release those muscles anytime, anywhere, whether you are sitting at your desk, watching television, or lying comfortably in bed. Strengthening your pelvic floor is the first powerful and foundational step in preventing, and in many cases, even reversing incontinence. And when you combine the targeted strength of Kegels with another gentle and restorative practice, yoga, you can unlock an even greater level of protection. In the next section, we will explore how yoga beautifully complements Kegels and why it may just be the missing piece in your personal journey toward renewed confidence and control. Now that you understand the fundamental power of Kegel exercises, let's explore how the practice of yoga fits into this comprehensive picture. You may think of yoga as merely stretching or a form of relaxation, but in truth, it is one of the most complete and integrated systems for strengthening your entire body, and that includes your pelvic floor. Yoga works in a truly unique way. It does not just isolate and target one particular set of muscles. It masterfully coordinates your breath, your posture, and your awareness. This holistic approach makes it especially effective for supporting bladder control and reducing the incidence of incontinence. When you perform certain yoga poses, such as bridge pose or chair pose, your pelvic floor muscles are naturally and synergistically engaged along with your core and hip muscles. This integrated method of strengthening helps to keep your internal muscular sling stable and responsive. Research that was published in the journal Female Pelvic Medicine and Reconstructive Surgery has shown that women who practiced yoga on a regular basis reported significantly fewer leaks and a greater sense of confidence when compared to those who did not. What is so beautiful about yoga is that its benefits are not just about physical strength. It is also about cultivating mindfulness and calming the nervous system, which can, in turn, reduce the sudden, urgent sensations that often accompany incontinence. I once worked with a woman named Janet, who was in her late 50s and told me that she had developed the habit of always mapping out the location of every single bathroom before she would leave her home. She began attending a gentle yoga class twice a week. After just 2 months, she noticed not only fewer physical leaks, but also a significant reduction in her anxiety about leaving the house. She explained to me that yoga had given her a profound sense of control over both her body and her mind. That dual benefit, the physical and the emotional, is something I see time and again in the women who choose to embrace yoga as a regular part of their wellness routine. So, how exactly does yoga protect you from incontinence? One primary way is through the breath. In the practice of yoga, breathing is not simply the act of inhaling and exhaling. It is intricately coordinated with every movement. Deep, diaphragmatic breathing strengthens the crucial connection between your core musculature and your pelvic floor. Think of it as tuning a delicate musical instrument. When all of the parts are working in perfect harmony, the entire system functions beautifully. This harmony helps to reduce any unnecessary pressure on the bladder and significantly improves the endurance of your pelvic floor muscles. Another key element is flexibility. As we age, our joints and our connective tissues naturally tend to stiffen. This stiffness in the hips, the lower back, and the pelvis can inadvertently make the bladder and the pelvic floor work much harder than they should. Yoga gently helps to restore flexibility, creating more space for your internal organs and reducing the overall stress on your bladder. When the surrounding muscles and joints are able to move with ease, the pelvic floor does not have to carry the entire burden by itself. There is also a significant emotional side to this that we cannot ignore. Many women who experience incontinence feel ashamed or deeply disconnected from their own bodies. Yoga provides a safe, nurturing, and non-judgmental space in which to reconnect. Through the practice of gentle poses and mindful breathing, you are gently reminded that your body is not failing you. It simply requires your care and attention, just like any other part of you. This compassionate approach works to reduce frustration and helps to restore a deep sense of trust in your own inherent strength. By blending the muscle-specific training of Kegels with the holistic, body-mind benefits of yoga, you are not just addressing the symptoms of incontinence, you are building a solid foundation of lifelong resilience. And the best part is, you do not need any fancy equipment, an expensive gym membership, or hours of free time. A few dedicated minutes each day done with consistency can create powerful and lasting changes. In the next section, we will dive deeper into how you can effectively combine Kegel exercises with simple yoga routines in practical, everyday ways that can truly fit your lifestyle. Now that we have explored the distinct benefits of yoga and Kegels individually, let's talk about how you can seamlessly blend them together into the rhythm of your daily life. The inherent beauty of these practices is that they are simple, discreet, and remarkably adaptable. You do not need a special studio or any particular equipment. You simply need a commitment to consistency and a little bit of patience with yourself. Think of it as creating a new, beneficial routine, much like the habit of brushing your teeth. Small, daily practices can lead to powerful, long-term protection against incontinence. A wonderful starting point is to pair your Kegel practice with a gentle morning yoga routine. For example, as you begin your day with a few minutes of deep, intentional breathing and gentle stretching, you can easily incorporate 3 sets of Kegel contractions. Aim to hold each contraction for about 5 seconds, and then fully release for 5 seconds. Over time, as your strength grows, you can gradually increase the duration to 10-second holds. Performing this practice while you are lying in a supportive position like bridge pose or child's pose can make the exercise feel more natural and intuitive, because these positions support your body and allow you to focus your attention entirely on your pelvic floor without any unnecessary distraction. One of my patients, Linda, a 58-year-old retired teacher, created a morning ritual that she affectionately calls her 10-minute reset. She spends 5 minutes performing gentle yoga stretches, immediately followed by 5 minutes of dedicated Kegel exercises. At first, she was not entirely sure that it would make a significant difference, but after just 6 weeks of this consistent practice, she noticed fewer nighttime trips to the bathroom and a much greater sense of confidence during her daily walks. That simple commitment gave her back a sense of personal freedom that she thought she had lost forever. Another effective way to blend yoga and Kegels is to use your breath as the anchor for the practice. Inhale deeply, and as you exhale, gently contract your pelvic floor muscles. Then, fully release the contraction on your next inhale. This steady rhythm not only strengthens your muscles, but also has a profoundly calming effect on your nervous system. If you have ever felt that sudden, urgent, and stressful need to rush to the bathroom, you know how disconcerting it can be. Coordinating your Kegels with deep, mindful breathing helps to train your body to stay calm and controlled in those very moments. Please do not worry if you miss a day here and there, or if you forget a few times. What truly matters is the consistent pattern you establish over weeks and months, not achieving perfection every single day. Think of it as nurturing a houseplant. You do not need to flood it with water, you simply need to keep it nourished on a steady basis. Incontinence protection is very similar. Small, regular acts of care lead to steady and cumulative growth in both your strength and your confidence. It is also critically important to listen to your body. If you ever feel any pain or significant discomfort, ease off and adjust your practice. The goal is always gentle strengthening, not creating strain. And if you are ever unsure whether you are performing the exercises correctly, I strongly encourage you to consider seeing a pelvic floor physical therapist. Many women find that just a session or two with a specialist gives them the confidence they need to practice safely and effectively in the comfort of their own homes. By weaving the practices of yoga and Kegels into the very fabric of your day, you are giving your body both the strength and the calm that it needs to effectively protect itself against incontinence. In the next section, we will take a step back and reflect on why these practices matter so deeply, not just for bladder control but for your overall health, your mobility, and your profound sense of well-being as you age. As we step back to reflect, it becomes abundantly clear that Kegels and yoga are not just about preventing leaks. They represent something much deeper, a tangible investment in your overall health, your mobility, and your quality of life. Think about it for a moment. Your pelvic floor is intricately connected to your posture, your sense of balance, and even your ability to enjoy daily activities like walking, gardening, or dancing with joy. By caring for these fundamental muscles, you are not only protecting your bladder, you are actively supporting the very foundation of your personal independence. Many women confide in me that the experience of incontinence makes them feel much older than they actually are. They begin to avoid social events, long trips, or even their favorite exercise classes out of a constant fear of embarrassment. But strengthening your pelvic floor with Kegels and restoring a sense of inner harmony with yoga can truly lift that heavy burden. It is much like repairing a leaky roof before the rainy season arrives. You restore your confidence, knowing that you can once again rely on your body when life surprises you. I remember a woman named Carol, aged 65, who once described her incontinence as a secret shadow that followed her everywhere she went. After she began to incorporate both yoga and Kegels into her daily routine, she told me that the shadow had finally lifted. "I feel like I got a piece of myself back," she said. Her story serves as a powerful reminder that these practices are not just physical, they touch upon your emotional and social well-being too. There is also an important and direct connection to your long-term health. The American Heart Association consistently emphasizes the importance of regular movement, including practices like yoga, as a way to keep your heart and your circulation strong. The Mayo Clinic highlights pelvic floor exercises as an essential practice for maintaining bladder control, especially after menopause. By combining these two powerful modalities, you are creating a holistic and comprehensive strategy for healthy aging, one that supports not only continence, but also your bone strength, your flexibility, and your mental calm. At this point, I would like to invite you to pause and reflect on your own life. Have you noticed times when the issue of incontinence has held you back from fully participating in life? Perhaps you hesitated to join friends on a trip, or maybe you have found yourself choosing your seat in a restaurant based on its proximity to the restroom. If so, please know that you are not alone. A great many women carry these unspoken worries. But I also want you to know this: your body is capable of profound change. and small, consistent actions can truly transform your daily experience. If you feel comfortable doing so, I encourage you to share your reflections in the comments. Sometimes simply knowing that others are facing the same struggles can be incredibly healing, and your story may be the very encouragement that another woman needs to begin her own journey toward healing. As we move into our final section, I will share the last key insight about how Kegels and yoga create lasting protection, and we will bring everything together into a warm and hopeful close. As we arrive at this final part of our discussion, let's bring everything together. We have talked about the targeted power of Kegels, the holistic support of yoga, and the many ways these two remarkable practices can blend seamlessly into your daily life. Now, the final and most crucial piece of the puzzle is consistency, the steady, gentle commitment that transforms small daily efforts into lasting, reliable protection. Think of it as tending to a beloved garden. A little bit of water each day is what keeps the flowers blooming vibrantly. And in precisely the same way, a few minutes of mindful movement each day is what keeps your pelvic floor strong and your confidence steady. One of the most hopeful truths I can possibly share with you is this: improvement is possible at any age. Whether you are 50, 60, or even 80, your muscles can still respond to exercise, they can still strengthen, and they can still adapt. The National Institute on Aging reminds us that regular physical activity helps to preserve our muscle health well into our later years. That means that it is truly never too late to start. Even if you have been struggling with incontinence for many years, your body still possesses the remarkable ability to heal and improve with consistent practice. I have seen this firsthand with countless women who thought their situation was utterly hopeless. One of my patients, Evelyn, aged 72, told me that she felt deeply embarrassed to even talk about her bladder leaks. With some gentle encouragement, she began a simple yoga routine combined with daily Kegels. 6 months later, she smiled radiantly as she described attending her granddaughter's dance recital and being able to sit through the entire performance without a single moment of worry. These are the personal victories that remind us why caring for ourselves matters so very deeply. Beyond the primary goal of bladder control, these practices carry positive ripple effects that spread across your entire life. Stronger pelvic muscles lead to better posture and improved balance, which in turn lowers your risk of falls. The calmer breathing and mindful focus of a yoga practice can ease stress, which benefits both your heart health and your quality of sleep. And most importantly, you gain back a profound sense of personal dignity and freedom, the ability to live your life fully without the constant nagging worry of accidents. So as you think back on what we have covered today, please remember, Kegels are your specific strength training. Yoga is your practice for overall harmony, and together they create a powerful shield of protection for your future. You do not need to strive for perfection, just for persistence. Start small, remain steady in your efforts, and trust that every effort you make is a direct investment in your long-term health and your independence. I truly hope that this conversation has provided you with both valuable knowledge and heartfelt encouragement. If you have found value here, I would be so pleased for you to share your own experiences in the comments section. Your voice matters immensely, and your story may be the very thing that inspires another woman to begin her own journey. And if you would like to continue learning with me, please consider subscribing to our channel and sharing this video with someone you care about. Together, we can build a strong and supportive community of women, growing stronger with each and every step. Thank you for spending this time with me. I'm Dr. Lily Stones, and I look forward to guiding you on your continuing journey to health, strength, and confidence. Before we close, let me remind you that this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you are experiencing pain, significant changes, or have personal concerns, please consult with your healthcare provider. Your well-being deserves personalized care.